The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc podcast. I'm Dr. Rednam. I'm a board-certified plastic surgeon in Houston, Texas with my Houston surgeons. Today we have a special guest, Dr. Akshay Sanan, who is in Boston, Massachusetts. He is a double-boarded facial plastic surgeon, and he's going to talk to us about all things facial. Welcome to the show.
Wonderful. Thank you for having me. I'm excited to be here.
So tell our listeners a little bit about what it means to be a facial plastic surgeon.
Absolutely. So as a facial plastic surgeon, my training started after medical school. So I went to Boston University for medical school. And when I graduated, I did a residency in otolaryngology head and neck surgery, which is different than a plastic surgery program, right? So in this residency, you get exposure to all things head and neck surgery related. Probably 25 to 30% of that exposure includes aesthetic and reconstructive plastic surgery of the face and neck, and a lot of rhinoplasty exposure. So I fell in love with facial plastic and reconstructive surgery, and then I did a fellowship in the specific field at Stanford University. So I did my residency at Jefferson in Philadelphia, and then I went to Stanford University in California, where I trained with Dr. Sam Most, who's internationally known for rhinoplasty and deep plane facelifts. And during this time, I got exposure to the nuanced aspects of facial plastic surgery. I was an attending physician at the Palo Alto VA, and I had clinical title at Stanford University School of Medicine. So I had some independence while also learning directly from an internationally known leader in facial plastic surgery. So that kind of set my career on an upwards trajectory. And being double board certified means I'm certified as a head and neck surgeon, but also as a facial plastic surgeon.
And, you know, your focus is pretty much everything above the clavicles. So you really spend a lot of time in a very focused area.
I tell that to patients. I only do surgery of the face, neck, and nose. And it's anything, like you said, above the clavicles or the collarbones. That's my wheelhouse.
Have you always been in the aesthetic realm, or is there a time where you were doing other things that are within the ENT world?
So when I graduated fellowship, I moved to actually initially Los Angeles. Now my practice is in Boston, but the first 4 years I was in Los Angeles. And the first 2 years I was doing both aesthetic and reconstructive work. So a lot of skin cancer, post-Mohs reconstruction, a lot of functional rhinoplasty, functional eyelid and brow surgery, and some facial nerve reanimation surgery. But then now I'm in my 6th year of practice. For the past 4 years, I've been exclusively tailored my practice to aesthetic and cosmetic surgery of the face and neck and nose.
And I think that, you know, we can agree, while we're in similar specialties, that the more you're doing of one type of thing, the better you get at it, right?
I would agree with that. And I tell lots of patients, I'm like, I basically do 5 to 6 procedures, but I do them at the highest level possible. And I do all the non-surgical stuff as well, but it allows me to really focus my practice. So if I'm doing facial rejuvenation surgery or rhinoplasty, like I'm really focused on that. And I try to be up to date on all the kind of literature, but then what people are talking about at meetings, and it allows me to really focus my practice.
Well, I've got lots of good questions for you. So while I do some facial plastics, I don't do any rhinoplasties. So I'm really, for me, someone's going to be like, oh, so tell me a little bit about using the piezo technique, because I know that's something I've heard about and things, but I really know nothing about it.
Okay, that's wonderful. This is one of my passion projects. So, a lot of things that you do in life, you're lucky for the mentorship that you have. So when you're in it, you don't realize what you're getting until you start doing things on your own. So when I was at Jefferson, my program director in head and neck surgery, he really published the first paper on what he called sonic rhinoplasty. So there's this instrument called the sonopet. And the sonopet is used by neurosurgeons, orthopedic spine surgeons, oral surgeons. It's basically when you have ultrasound waves and they vibrate really fast, that generates heat. And that allows you to sculpt and mold bone very precisely and causing less trauma on the surrounding skin, muscle, and tissue, right? So the sonopet, he used to use it for rhinoplasty for if someone has a bump on their nose, it's predominantly bone, you can file the bone down. Because traditionally, the way rhinoplasty is done is with a hammer and chisels and also some sort of filing instrument. Much more traumatic on the skin, the muscle, and causes more pain. Then when I went to Stanford, my fellowship director, he used the tool, the ultrasonic piezo. And this was designed specifically for rhinoplasty surgeons, more ergonomic, more designed to rasp the bone down, but also part of a rhinoplasty is to narrow somebody's bones. You would typically take a hammer and chisel and literally break the bone in, as you've probably seen in your training. And with the piezo, you are literally etching a line in the bone under direct visualization, which sets you apart from the hammer and chisels because that's done blindly and by feel. And what I've noticed with patients is that there is less swelling, less pain, and less bruising compared to the traditional way. So now I'm lucky that I'm able to offer that to my patients who have bony issues. The tip work, you still do a traditional rhinoplasty way, but any sort of bony work, bump, narrowing the bones, that can be done with a piezo instrument. And it really has been a game changer in my practice.
Well, and I mean, with rhinoplasty patients, right afterwards, swelling can just hang around forever. So if you can reduce that from the get-go, that is a big deal.
I think it's incredible that when I did it, when I was in my first couple years of practice, I did it the more traditional way, the hammer and chisels. And people, when their biggest fear after rhinoplasty is how swollen they're going to be, right? They get these like raccoon eyes, black and blue eyes, and it's scary, right? With the piezo, I've noticed when I see patients at their 1 week follow-up, like they have such minimal bruising, minimal swelling. And honestly, I ask them about their pain. They may take one pain pill, like a Percocet, and they quickly transition to Tylenol, which has been a huge game changer because people typically have a lot of soreness and pain and they're taking Percocet for many days or a week. And now I'm able to reduce that component as well.
So I'm curious, again, since I don't do much of this, like how small is this? Like how precise is it? Like you're able to like protect the soft tissue around while you're doing it?
It is. So when you are doing the rhinoplasty, you have an instrument that you're holding the skin up. So you're looking directly at the bone, okay? And it's like the size of this pen. It's a little bit wider, but you hold it like a pen and you're literally, you're scraping on the bone as it's vibrating, and you literally see the bone melt in front of your eyes. It's incredible.
It's pretty cool. That's pretty cool. Yeah.
It's a great teaching tool. I'm one of the things that's been nice is that I love to teach. So I'm on faculty at Harvard Medical School, and I have the ENT chief residents come and observe me. And it's when I was learning how to do rhinoplasty, like osteotomies or breaking the bones is a very abstract, like kind of you're a magician when you're seeing your attending surgeons do it, right? Now when I'm teaching it to someone, they can see exactly where the line is being made in the bone. And when I push the bone in, it clicks and it makes sense.
So you don't have to worry about the taps being perfect.
Yes, exactly. Yeah. When you're in residency or when you're doing it the traditional way, you need your assistant to tap perfectly. It's like soft or firm, but now you don't need that.
Well, it sounds like it's a much more predictable way to do it then.
Oh, it's been amazing. I know exactly where I made the line in the bone. I push it in, and when you feel, one of the concerns when people do it with a hammer and chisel is that you may feel the osteotomy or where the bone is broken. With this being so precise and you know exactly where you're going, I haven't encountered that problem either.
Very cool. How long, I guess, how many people would you say are using this technology, like in the US?
So it was common when I was in California. I think like in Massachusetts, as far as I know, I'm the only surgeon who's doing it this way. There's another surgeon in all of New England who does it. I think it's more common in like San Francisco, Los Angeles, New York City, Miami, like in little bigger metropolitan or plastic surgery areas. There's a learning curve to it. And, one of the things as a surgeon is once you get set in your ways, you're like, this is how it's done and it works for me, right? And for me, it was a nice evolution because I got it early on in my career. There's a learning curve. There's also a capital investment, but it is pretty minimal, to be honest with you. For me, why I moved away from the hammer and chisels was that I just found that patients were healing faster, the swelling was less, bruising was less, the pain was less. So for me, it was a no-brainer. It does add some time to the surgery because it takes more time to be precise and like see where you're making the cut in the bone. Whereas with the hammer and chisels, you can pretty quickly narrow the bone. So it adds, maybe 15, 20 minutes to the case. But in my opinion, it's well worth it.
Well, with the rhinoplasty, little moves make big differences. So, I mean, that's what you want in your surgeon. You want someone who's going to spend that time with those little details.
I completely agree. I tell my patients everything I do, whether it's rhinoplasty or facelift, it's a game of millimeters. So you have to be very attentive, like very, very type A in terms of very dialed into the patient that surgery.
So, have you seen an increase in the number of people who are seeking out rhinoplasties? How do you feel like that particular procedure has changed over time?
I think rhinoplasty or nose jobs are timeless. They have been around for so long, and the most common reasons why people go undergo a nose job is that they have a bump on their nose. They feel like their tip is maybe a little too meaty or bulbous or it's droopy. Maybe their nose is a little crooked, right? So these reasons they don't go out of style. There's really not much of a non-surgical option. I do liquid or non-surgical rhinoplasty, but in a very select group of patients. I am finding anecdotally that my patients are getting smarter and smarter. They're more savvy. They're coming and requesting for the piezo technique. I have people kind of in the region who drive down from Maine or like Connecticut, New York area who are coming in. I've had patients fly, even when I moved from California back to Boston, flying specifically for the technique, because ultimately the biggest thing I hear from these patients is they've been holding off to have a nose job because they didn't want to have the hammer and chisels. They didn't want to have the pain associated with that. They've seen friends or maybe their mom had it, and they're really like, I don't want to undergo this. So the demand for rhinoplasty is it's only continuing to. It's one of the most common procedures plastic surgeons do.
Yeah. Yeah. Well, no, I mean, I think that's great. Like I said, you always want to stay at the cutting edge of what you're doing to be able to give your patients the best experience.
I completely agree with you. I tell patients, I'm like, just because I use this instrument doesn't mean I'm a magician at rhinoplasty. Ultimately, they judge you by your results, right? So, like, rhinoplasty is an art in addition to a science. So every rhinoplasty is like custom made. It's like bespoke, like one of one to fit the patient's like facial features, right? And I'm like, it's a tool at the end of the day. So it's another tool in my toolbox, and I find it to be a very effective tool. And don't worry about how I get you from A to Z, but if you like the end result that I'm producing for previous patients, then I think you're a good candidate for this procedure. And it just so happens that the tool I use will give you less bruising, less swelling, less pain.
So, for aesthetic reasons, is there a minimum age that you usually will recommend someone be for, considering a rhinoplasty?
Yeah, that's a great question. So I think about facial development, right? The facial skeleton. So one of the risks of a rhinoplasty, if you do it too early, is you might stunt somebody's nasal growth. So then things look disproportionate to the rest of their face. So for that reason, I will operate the youngest on a female is 16, and then on a male, I wait till they're 17. And, that's something that I was taught to do, and it's proven well for my career.
Do you see a lot of people who are in that 16, 17-year-old range coming in with their parents? I'm just curious.
Yeah, I think, in Boston, in the New England region, the patients are coming in and they're in high school. It's more like junior year of high school or end of junior year planning before they go to college. The parents
Yeah,
are bringing them.
fresh start.
And also freshmen and like freshmen, sophomores in college, it's common. Then it kind of becomes a lull until someone's a young professional. Like they get some of their own disposable income that they're going to pay for their rhinoplasty. But the parents do bring their kids in around that right before the summer vacation, right? So they come in February, March. Okay, we're going to do the surgery in May. He or she will recover during the summer, and then they're ready to go to college.
Yeah. Well, that's great. So I know another procedure you perform a lot is a deep plane facelift.
Yeah.
So can you explain to our listeners most people just think facelift, right? And what is the difference between a deep plane facelift versus other techniques?
So I think that one thing for our listeners to understand is that not all facelifts are created equally. And there are, the facelift when it was originally described, it was a skin lifting procedure, right? Like you got the skin of your face lifted, pulled back as tight as possible. And then we saw the things that people are terrified of, like this deer in the headlights type of look, or, over surprise look, or an over pulled windswept look. Then there was underneath the skin, there's a layer of tissue. It's called the SMAS, S-M-A-S. Basically, think of this as a very robust tissue layer that covers your facial muscles. So that was the next phase of facelifting, where surgeons would lift the skin up, and then they would take some stitching through the SMAS layer and try to lift the face up. They got better results than just lifting the skin up. The next foray has been deep plane surgery. So the deep plane means you lift the skin, not as much as they used to with the traditional facelift, and then you separately lift the SMAS layer. And when you do that, We know anatomically there are 4 ligaments that kind of pull your face and neck down. So you can cut through those ligaments and you've got full mobility of someone's face and neck. And that is the deep plane. When you have control of the deep plane, you can lift someone, and we know we age in a vertical fashion. So you can lift their face and their neck vertically instead of horizontally, which is one of the reasons why old school facelifts have this negative connotation to them. And when you do that, there's not as much skin removal as you need to do. And patients also, they look very natural. And that's one of the beautiful things about deep plane surgery is someone looks 10, 12 years younger than when they started before surgery.
Mm-hmm. And you're not separating the skin layer quite as much, so you don't have as much swelling as you may have with the other types of facelifts.
Yeah, that's a great point. So when you do deep plane surgery, you don't have to lift as much of like a lengthy skin flap is what we call it. And therefore the connections, the blood vessel connections to the skin are still maintained. So there's less swelling, and then the skin tends to heal much better because that skin flap has more of a robust blood supply, but also there's not much tension put on the skin. Like people are always worried about facelift scars, and you can get bad scarring if there's tension, meaning there's a lot of pull on the skin. So if you just lifted someone's skin and pulled it back as tight as possible, you're relying on that skin to really suspend the face. That's a lot of tension, so people will get bad scarring. With deep plane surgery, we don't find that to be a problem.
And I know the answer to this question, but I'm going to ask it to you. Then why isn't everybody doing a deep plane facelift who does facelifts?
This is it's like the $1 million question, right? And it comes down ultimately, like what I said earlier, it's like who your mentors, your training. Like surgeons are a product of the environment that we trained in. Now that doesn't mean you can continue to grow as a surgeon after you finish your training, but I'm lucky and I'm fortunate that in my time as an otolaryngologist or head and neck surgeon, we did so much cancer, parotid gland surgery, facial nerve dissection that you feel very facile and uncomfortable with the anatomy. So when you learn how to do deep plane surgery, you already know these tissue planes. And this differs from like when I have colleagues who did a general surgery residency and then a plastics fellowship or integrated plastics training program. The training model is just different, right? So some people may get deep plane exposure, some people may not. And as far as facial nerve dissection, very unlikely in a plastic surgery program compared to an otolaryngology program. So the foundation was set for me. But then I also, when I was living in Los Angeles and practicing, I would always go spend time with like the biggest name surgeons and who had high volume facelift practices just to continue picking up these nuances, to take my career, like continue evolving my facelift approach. I think surgeons who are mid-career or later on in their career, they're set in their ways. It's hard. There definitely is a learning curve for deep plane surgery. Once you get below the SMAS layer that I was talking about, there are the facial muscles, there's the facial nerve. Someone who's not very facile with that anatomy, it is, it's nerve-wracking, pun intended. And it's sweat inducing that when you're dissecting in that area, there's no question about it. So I think there is a hesitation to do it. If you look at the research, people ask about, there's a risk of nerve injury. Quite frankly, whether you do a SMAS facelift or a deep plane facelift, it's all user dependent, right? Surgeon dependent. The results in terms of facial nerve injury or any sort of negative consequence, there's no difference between the two.
Right. And I think it's, what we say a lot of times is that there's different ways to get good results, but there's also sometimes just better ways to do it,
It's tough because like the current practice model I'm in, there's a senior surgeon. I'm with 3 plastic surgeons, like plastic surgery background. I'm the only facial plastic surgeon. And the training models, the thought process is different. And, I'm not going to, if I see a patient, I just say, listen, these are my results. Do you like them? And they'll comment, the jawline's really crisp, the neckline's really crisp. I said, this is my technique. Okay. And I say, you know what, if you want to learn more about this, like some of my partners do more of a traditional facelift or, SMAS facelift, and you can see the end result, right? So at the end of the day, it's like that rhinoplasty thing I was talking about. It doesn't matter what technique I tell you I do. Do you like how crisp the jawline is, how lifted the cheek is, how crisp the neck is? Then we're a good match.
That's true. And I mean, we don't want our patients to get too caught up in some of that. And I think with what's so much information available, sometimes it can be like daunting, but just remember how many years it took us to really understand all this stuff. Plus, we're continually learning more and more about it.
100% correct. It took 6 years of residency and fellowship just to get the basics down. And then you're in practice and you learn every time you do surgery, you're always learning. And you talk to a patient, patients come in asking all these technical questions, and it's like, hold on, like I went through all this training and now I feel comfortable talking to you. Like a 30-minute conversation, you will not be an expert at this surgery.
Yeah, yeah. So, what are your thoughts on obviously there are trends? So, more and more younger people
Hmm.
are starting to potentially seek out facelifts, and not necessarily for aging reasons. They want to change how they look, and more people are doing alternative. Or so now there's an endoscopic technique
Yeah.
that's gaining popularity. So, kind of, what are your thoughts on all this kind of new emerging stuff?
So I think that there is definitely a shift in patients. Even since when I was in training, people were probably mid 50s going for their first facelift. We're seeing patients even in their early to mid 40s coming and talking about it. Some women don't want to go down the road of non-surgical treatments, whether it's like heat-based therapies, microneedling radiofrequency, or face title therapy, and they're noticing signs of aging, right? So they're getting the early jowl formation, neck looseness, and they want to undergo the surgery, and they want to age as beautifully and gracefully as possible for the upcoming decade. And I'm all about that. Like, I think it's ultimately it's your body, your decision. I'm here to kind of guide you through that. If I think objectively I can make an improvement, then I think it's a very reasonable thing to undergo. And the reason why is one of the beautiful things about deep plane surgery is patients, they look like themselves. They just look like a younger version of themselves. They look naturally beautiful. Then my patients tell me that like I recognize a younger version of myself, right? And that's such a compliment and testament to the fact of how deep plane surgery, you're addressing the root cause of aging, which is that layer that's pulling down and the ligaments that tether your face and neck down. Now, endoscopic brow lifts, you asked about that. That has been, I've gone to lectures, I've gone to anatomy cadaver labs. That is something that's being pushed by a handful of surgeons in America, and there are surgeons around the world who are doing it as well. Endoscopic deep plane facelift, essentially you're making incisions in the hairline using an endoscope, which is a camera to kind of release those tethering points. One of the things is it's going to be done on a younger patient. You can't have much skin looseness because ultimately you do have to cut some of that extra skin out. So you're not able to do that as effectively with this. People who are really concerned about the scar in front of the ear, you still make the incision behind the ear. It is an option that's available. I don't offer that to patients. I find in my hands like a regular deep plane face and neck lift, the incisions heal really favorably. I get really good control of the cheek, the jawline, the neckline, and I haven't had patients ask me about it. I'll be honest with you.
Yeah. Well, I think it's an interesting area, but you make a good point. What you said earlier is like if you like how my results look overall, don't get too worried about the technique I'm using. It's the end point that's what the goal.
Yeah, I mean, as a plastic surgeon, as you know, you're judged by your closures and you're judged by how the patient looks. No one cares what it took you to get there, right?
Correct. Correct.
So I try to remind them that, like, I teach my patients as much as I can, simplify it that there's like the skin layer, the muscle layer. I gotta lift the muscle layer and then cut the extra skin out. It's not just about tightening the skin, and they comprehend that.
Well, you mentioned earlier, right, all these non invasive devices.
Yeah.
So I think a common question we get asked is okay, if I choose to do these things because I maybe aren't ready, I'm not ready for surgery yet, how does that then affect things later if I do decide to get a facelift or a neck lift?
Yeah, so that's a great, it's a whole topic of conversation. I think I tell patients everything in moderation. Okay. If you're like, I'm not going to do a facelift for the next 3 to 5 years, go for it. You can do these non surgical treatments. They're ultrasound based devices, they're heat based devices. Just don't overdo it. Like people who go every month and try to like fry their face, that's going to cause a problem. So basically, these devices, I tell patients it's like putting your head in a microwave and hitting start. Like you're literally melting because, and I've seen it when people have a history of multiple sessions of these ultrasound or heat-based devices, you're not cutting any skin out. You're basically shrink wrapping it, but it's not just the skin. You're also shrink wrapping that SMAS layer. So when you go into someone's surgery to lift their face, that tissue plane that divides the skin from the SMAS is very adherent or fibrosed. And then when you try to lift or manipulate the SMAS, it might be very, very kind of friable because it's been with all these, if you do it multiple times. Now, if you did it once 5 years ago, I'm not concerned about that. The same thing happens when patients are doing like collagen biostimulators, like Sculptra is an example, right? I tell patients, I have no problem with you doing Sculptra, just don't do it for at least a year before you undergo your facelift. Okay, let your skin and your body have a chance to get rid of the inflammation, let the Sculptra kind of do its thing, settle in, because it can look like a bomb went off if someone gets it routinely, and then 3 months later they're coming in for a facelift and they want you to do it. The tissue planes are just adherent, swollen, and it can cause, that's where you can get into trouble.
Yeah, and I know it's hard sometimes for people who are non-surgical to visualize that, but at the end of the day, we have to be able. These are very fine planes, and if we can't get into it easily, that's when issues can occur and damage can occur.
It's not even it's like issues can occur like facial nerve. There can be persistent swelling. If we talk about fillers, think about fillers, or that's a whole other conversation, like filler fatigue. But people have done years and years of fillers, and even if you dissolve their fillers before a facelift, they can still have prolonged lymphatic edema or swelling, like in their cheek area or the corner of their jawline area, that you have to patiently coach along, maybe do some more dissolving, or have them do a lot of lymphatic massage therapy.
And so sometimes that's also why it's like if you've gotten a point where you're just going so regularly, that's really maybe the point to think maybe I need to switch from this and I need to consider something that's going to give me a longer lasting result.
I agree with that totally. One of the things when I think about like a patient or a consumer in the aesthetic industry, right? There's so much information in terms of procedures that are available, non-surgical treatments that are available, and they really rely on us to guide them, right? The thing is, if someone doesn't do surgery, they don't know the limitations, in my opinion, of like when to stop, and that's where I think there's an art to it, and that's where I really like try to educate the surgeon, the surgical folks in the area through seminars or just the things that we do on Instagram, that if someone needs a facelift, but you keep on filling their cheeks, telling them they're going to lift, at some point the patient gets this kind of dysmorphic appearance to themselves and something clicks. And I've had patients come in and they've been told for years that, oh, putting cheek filler in, it will lift your skin and make you look like you had a facelift. It doesn't work like that, right?
Yeah, I wish it did. I wish you could just stick it up there, but it doesn't work
I
that
wish it
way.
worked like that. Then we'd all, we'd be very, very wealthy people. But the thing is that then you have to talk to a patient about, I have to now dissolve this filler, right? So they were told and they were convinced that this was lifting. Now I got to dissolve you. So they're like, oh my God, I'm going to be flattened out. I'm going to be basically like dehydrated. But you have to normalize their skin again. And they have to get used to the fact that that's what they used to look like, right? And that definitely is an element in my practice. Fortunately, it's not that big of a thing, but I do have patients coming in who have done surgery on, and you have to kind of guide them through that initial phase.
And I know another thing that a lot of times people are scared about, because obviously it's their face, is the pain associated with it. And I know that I've found that, but surprisingly, you can do so much to someone's face and not have that much discomfort. Is that something that you kind of discuss with them and explain to them as well?
It's amazing that you can do such an extensive surgery on somebody and they may not take a single narcotic pain medicine. They feel tight, which is a good thing. They feel like pulled, which is a good thing. You did those things, but they do not feel in pain. And I ask every patient of mine, I'm like, how many pain meds did you take? Right? And you'd be surprised. Oh, I'm not in pain. I just feel tight. I feel swollen. Those are the things you hear. And it's incredible. Like you said, you can do so much to someone's face and neck and they're not in crazy pain.
And as somebody who does a lot of body work, it's totally the opposite. Like there's times where I've done their body, and then later I'm doing their facelift, and they're like, "Well, that didn't hurt at all." And I'm like, "I know, it's the face is amazing."
The face is truly incredible. Like when you do a deep plane facelift, neck lift, and I usually combine some sort of brow lift, but it's lateral endoscopic. The brow lift is the part that hurts the most, which patients are like always like, I didn't expect that
I
to
got
happen.
a headache. Yeah.
Exactly, their headache, the temporalis muscle gets irritated, and they have a headache, not their face or their neck.
So tell me something that you're really excited about that you are seeing, like the not necessarily trend, but what's like coming up in the future of facial plastics that you feel like is really exciting to you.
So and I talk about this multiple times a week with patients. I think lip lifts are like the way of the future. I think that a lip lift done well is so beautiful. It creates more youth, more femininity, and it is natural, right? I am seeing patients more and more who have done, because lip filler has been around for a long time, and I think lip filler is wonderful. I'm not bashing lip filler at all, but for some patients, it's not the right thing to do. If they have a long, and this could be young or older patients, if they have a long upper lip or they don't have much of a lip to inject in, they're better off undergoing a lip lift and like creating a new lip for them, and they can still get filler into that new lip, but it transforms the someone's face, and it can be done in isolation or it could be done in combination with like a deep plane face and neck lift. That to me is very exciting. And when I've been in practice now in Boston for a couple of years, And it very much so is considered a novel procedure. When I was in LA, it was much more well known and commonly. And that, to me, it's a very exciting opportunity in the area that I live to continue educating, teaching patients about it. And also I go and meet with like the cosmetic dentists in the area who are doing a lot of restorative dentistry,
That's a
veneers.
smart idea. That's smart. Yeah.
Because and many of these folks are thinking about like perioral or around the mouth rejuvenation. It's not just the teeth and the bone, but then there's a skin component to it as well. So there's definitely this interplay between both specialties, and a lot of education has to be done, but people don't even know this procedure exists.
So when you do a lip lift, are your patients awake or are you putting them to sleep?
I offer it to patients based on their comfort level. I will do only numbing injections, like on the dentist's office. I will do numbing injections plus oral sedation if they want that, or I'll do IV sedation. So we have a board certified anesthesiologist who comes to the office and does IV anesthesia, so the patient is asleep for it, but they're still breathing on their own. So I'm comfortable doing it however the patient feels comfortable.
I think it'd be pretty nice when you're awake because then they can literally see when you kind of hold it up, like how much their change is, you know?
Yeah, once you inject them up, the lip gets very swollen, just like when you put a needle for lip filler. So the key for a lip lift is when you do your preoperative counseling, you like show them the measurements, you kind of show your before and afters to give them an idea what to expect. But once then, and then you have to make your incision. Sorry, you have to draw out your incision, and that is what you have to stick by. Because once you inject the numbing, everything gets kind of distorted. So on the table when they leave, it looks very swollen. I tell them for that first week, it's going to look like a bunch of bees stung your mouth. But then very quickly the swelling goes away and they love their results.
How long do you usually tell people it takes before you can like really appreciate like this is close to what you're going to get?
So I tell people social downtime is about 2 weeks, and I use that as a surrogate in the sense that I had a patient last year. She went on her honeymoon 2 weeks after her lip lift. Okay.
Oh, wow.
So
Okay.
she flew to Paris and she went, she was like, and she looked fantastic.
Man, she
Sure,
was really cutting that.
she was.
You probably felt like a little sweaty.
I felt there was definitely a moment of pause, but
Yeah.
the incision, she's like, I'll put makeup on it. There's a little red line, but she's like, I just love how my lip looks. Like she was not bothered by it. I'll tell people about at that 3 month mark, you're about 90% healed in the sense that your lip, in terms of swelling or stiffness, is dramatically like more or less gone. You kind of forget that you had a lip lift. Your incision is starting to fade away, but it takes a full year to really kind of have the scar kind of minimized. But just like there's a deep plane in the face and the neck, there's also a deep plane in the lip, right? There's the skin layer, there's a SMAS layer, then there's the muscle. So I do a deep plane lip lift, and I learned this when I was in California. And you take the tension off the skin, and the incision heals beautifully.
And I think that's most people's concern with that is like, how's my scar going to look under my nose?
Exactly. But I show them the examples, and people tend to heal beautifully. And you can also make the incision where the nose meets the upper lip, and sometimes you got to make an incision on the corner of the lip if somebody has like a kind of curled in lip to evert that. And that is a concern people have, but in my experience, the incision heals very, very favorably.
And this is like a good time for me to point out that's why you want to go see someone who does a lot of this particular type of procedure and doesn't dabble because these small things he's mentioning make a big difference on your end outcome.
Yeah, I mean that's true about anything. Like you do a lot of body surgery, and you want to go to somebody who does a lot of something, right? And this goes back to the aesthetic industry. Patients don't know, and like you're like half the job I feel like is educating, informing, making them feel like they're making the right decision. You know, maybe seek like another opinion so you have perspective on like what they're getting. I am a fundamental believer. Like if you do something, do a handful of something, and just be the best at it.
Yes, I totally agree with you. And thank you so much for joining us today. I feel like I learned a lot. And, like, there is a lot of really exciting things kind of coming out in the forefront. And I think the goal, what we're trying to do with everything, both facial and body, is that to get really natural results.
Absolutely.
Like make people guess whether you've had something done.
That's it. Like we are in this, what we call this like undetectable era, right? Like I tell patients we're in this like quiet facelift era. You see celebrities that are like kind of disappearing for a month, 2 months, they resurface looking incredible, right? So people are asking what's happening. Same thing happens in our practices. When you do a facial rejuvenation surgery, right? I have patients who like kind of disappear, lay low for 3 to 4 weeks. They resurface, their own families, like I'm talking like their parents, their cousins who see them regularly, they can't even tell they had a facelift. They think they got their hair done. They think they lost weight
They
eating.
slept a bunch. Yeah.
We are in this undetectable era, and it's amazing. So whether it's with the body surgeries that you're doing, deep plane surgery with the face, the neck, you can also do a deep plane neck lift on its own. Like someone has a double chin genetically, you get rid of that. People just ask, hey, have you been working out? Not that you had a neck lift, right? And lip lifts are part of that category. And it's an exciting time to be in plastic surgery because I feel like our techniques have really gone to the next level. I think there's so much transfer of information, whether it's going to meetings or these Telegram groups, and people are sharing what they're doing and what works. And there's much more transparency in addition to the technique, the anesthesia. Like it's an amazing time, and patients are recognizing that.
Yes, they are. And I think that's why a lot more people are seeking out things because more is being shared and they're seeing that, hey, I can kind of get the look I want without it being obvious. So I love that.
1,000,000%. I completely agree.
Well, thank you so much for joining us. If any of our listeners wanted to find you, they wanted to get some work done, how do they find you?
Well, first of all, thank you for having me on the podcast. This has been a really fun conversation. Anyone who's listening, interested in seeing me, you can go to my website, www.drsanan.com, SANAN. I'm on Instagram, TikTok, Dr. Sanan MD, and I'd be happy to see you and talk to you.
Okay, definitely give him a follow because lots of pearls and lots of wisdom, and I'm sure beautiful photos too. So
Wonderful.
Thank you again so much for joining us. And thank you all for joining us on the Confidence Doc podcast. Tune in next week for another exciting episode.